is Lauren, Dr. Lauren Manna. I'm a physical therapist. I'm the owner of Tandem Physical Therapy and Pilates, which is where you all are this morning. I think everybody's here to talk about neuropathy, right? Like to learn about that?
Yes.
Yeah, okay. Lots of people in the room this morning, which means neuropathy is affecting a lot of people. As a clinician that comes across a lot of people with various different issues, low back pain, neck pain, shoulder pain, commonly we talk a lot about neuropathy. So it's always, hey, do you know what you can do for neuropathy? Like I have burning in my feet, or my spouse has like tingling. A lot of people are really frustrated, and that's why we wanted to have this discussion and just invite people into the clinic this morning. So hopefully I can answer some of your questions and we can learn a little bit more about alternative solutions that don't just deal with medications or just lifestyle changes or things like that, which is what a lot of people are told when they talk to their doctors about these things. So, a little bit about Tandem Physical Therapy and Pilates. So we started our clinic back in 2018. We are a physical therapy and Pilates studio. Our claim to fame is that we do integrate Pilates into a lot of what we do. We strongly believe in like having a good foundation, a solid core, and integrating some of these principles into what we do to help people, which kind of sets us apart from some other places in the area. Back in 2018, I had started this business with one other person, and we were working at another clinic, and it was a busy clinic. If you guys anybody's been to physical therapy before? Anyone? Yeah, right? Okay, most people in this room, okay. So you kind of know, most places you're like, you're in and out, there's tons of people, it's a room like probably like this, you're sharing your time with other people, and we just kind of got tired of that, and we felt like we weren't really able to help people in the way that we wanted to, that people deserved. And so we started Tandem Physical Therapy with the idea that we were going to work with all of our patients one-on-one for 1 hour, and that's what we do. So it's not something where you're seeing a bunch of technicians or aides or anything like that. You work one-on-one with your PT for an hour, and that's how we wanted to help people, and that's what we do here. So we primarily work with people in their 50s, 60s, all ages, all ability levels. We meet people where they're at, but that's a little bit about what we do. We're orthopedic, manual physical therapists. That means we use our hands, we touch our patients, we see what's going on. We want to know what the problem is, understand it from your perspective, and then come up with a game plan on how to help. So, we're a team of about 8, 9, 10 of us. So, picture of a few of us here at one of our recent parties that we host every year. Enough about me. We're going to talk about why you guys are here. Neuropathy, right? So like, why is this happening? Why do the symptoms often get worse over time? Why so many treatments fail, right? Like, why isn't the medication working? Or why isn't, my doctor sent me to therapy for this, why isn't that working? What are some new treatments that maybe you don't know of? Maybe your doctors don't know about it. That happens. And then what can you do starting today? Are there any changes or any decisions you can make today to start making some progress? So that's what we're going to discuss. Okay. Common symptoms of neuropathy. Anybody have burning in the feet? Oh, good. Raise of the hands. In the hands? Any hands? Yeah? Got some burning in the hands? Yeah? In the fingers? Yeah. Numbness. Any numbness? Yeah? Like bottoms that can't feel the bottoms of the feet? Have a hard time figuring out like hot and cold? Like one foot feels colder than the other, toes? Any of that stuff? I see some nods of the head, yeah. Does it give you trouble, the feet symptom people? Trouble with walking, balancing, you feel unsteady? Like you're not really confident in what you're doing? Does it ever make you feel like you just, like you can't go out, you can't go on vacation, you can't walk for long? So in my experience, talking to people, it often feels like their world's getting smaller. The world gets smaller and smaller because there's more that you can't do than what you can do. Yeah, so pretty much everybody in this room, something on this checklist, I think. Yeah, this will be good. So I always like to tell stories when I present. So we have a client, his name is John, late 60s. He comes in, we're talking, tells me he's got burning in his feet, worse at night. Most of the time this stuff is worse at night. So he has a hard time sleeping. John's not sleeping, his feet are burning, and he's feeling unstable when he walks. Doctors, it's like, yeah, you're just gonna have to deal with this. Which is why it's so frustrating, right? Like many patients hear from their doctors, oh, it's your diabetes, it's a part of getting older. That's a tough one. Does anybody's like eyes roll when it's like, oh, it's because of your age, you're getting old. Take this medication, right? Like here, take some pills. But the problem with the medications too, if they work, they're only really masking your symptoms, and they're not really getting to the underlying cause, which I think is what most people are very interested in. Like, why is this happening? Like, can we treat the cause? Because I don't want to take gabapentin forever. I don't want to take Lyrica forever. There's got to be something else. So it's very, very frustrating for people. Peripheral neuropathy is when you have damage to the nerves outside of the brain and spinal cord, okay? So the brain and spinal cord, we refer to those as our central nervous system, and then the nerves that exit and leave and go to our hands and legs and feet and toes, those are our peripheral nerves. And when you have damage to a peripheral nerve, we call that peripheral neuropathy, okay? These nerves are going to control things like your sensation, they're going to control your muscles, they're going to control your circulation, they help to control balance, okay? So those are the nerves that exit out of the spinal cord. So on the right side, you can see what a healthy nerve signal looks like. So the brain sends information to the body through the nerves, okay? It's like a computer system. So a healthy signal is just like, it's straight through, no interruption. So the brain tells the body what it wants to do, lift the leg, it does it, okay? Now when you have damage to a nerve, that signal gets a little scrambled, okay? So the brain's trying to tell the body what it wants to do, but there's damage to the nerve, there's damage to that pathway. And so what you might feel is tingling or numbness or burning, right? Instead of lift the leg, maybe you can kind of do it, or maybe it's shaky, or maybe you can't do it at all because that pathway is distorted, it's damaged. So again, just healthy nerve signal, straight through. Damaged nerve, it's kind of splotchy, it's scrambled. You're not getting information properly to the destination. Again, so this results in burning, tingling, numbness, difficulty with hot and cold discrimination, weakness, loss of balance, okay, because we're not getting that clear signaling. Now, why do they start in the feet, right? Like, why the feet? So nerves that run all the way from the spinal cord down to the hands and the feet, those are long nerves, okay? More room to have damage or to have an insult or lesion along that pathway, okay? There's more vulnerability there. Now, a long list of causes, and so if you have peripheral neuropathy, it can be caused by a multitude of things. Diabetes, okay? That's high blood sugar. That's not good for the body for many, many reasons, but it damages the nerves. Damages nerves to your eyes, damages nerves that go down to the feet. Not a good thing. Kidney and liver damage, So if you have exposure to toxins, like prolonged exposure to toxins in the blood, it can damage your nerves. The same thing is true with chemotherapy. Okay, so I'm skipping one, but folks that have chemo and they have the drugs that go through their body, right, that can damage the nerves because your body's exposed to those toxins for a period of time. Infection, so shingles, HIV and AIDS, Lyme disease, hepatitis, these kinds of infections, that can cause neuropathy. Vitamin deficiencies, especially B vitamin. So especially B vitamin, when there's poor nutrient absorption, like if there's alcoholism or celiac, you're not absorbing vitamins properly, that can cause issues. That can lead to deficiencies, autoimmune diseases. The body can attack the nerves. That's something, injuries. So if there's a compression or stretch, carpal tunnel is a peripheral neuropathy. If you've had a brachial plexus injury, if you've had nerve pain go down the leg from your back, that's a neuropathy. Okay, so there's injuries, damage, musculoskeletal issues, circulation problems. Nerves innervate vessels. They cause vasodilation, like when the vessels get larger, and vasoconstriction, when they get more narrow. Okay, so nerves control so many parts of our body that we're not even aware of. And there's some idiopathic or unknown. Sometimes they don't know the cause of the neuropathy. That's frustrating. Studies show that about 71% of patients with peripheral neuropathy do desire change and are seeking better treatments. So that is most of the people, that's everybody in this room, otherwise you wouldn't be here. So 71% are looking for something different. It's not working for whatever's working, or like whatever's happening, the traditional treatment model is not working for the majority of people. The economic burden, peripheral neuropathy does contribute significantly to healthcare costs, higher medical expenses due to complications, all the reasons that I just listed that are common causes. It's expensive from a healthcare perspective. And then there's an increased risk of depression because of the sleep disturbances and because of the functional impairments. Like when your body's not cooperating and it's not working and you don't feel good, you don't feel your best, that's very understandable. That's very normal to be upset and to not be happy with that. So there is a higher risk of depression in the neuropathy demographic. So why does it get worse? Because if you're not getting the proper treatment, your circulation is going to continue to decrease. The nerve cells are going to continue to weaken, and the signaling is going to continue to misfire and not work properly. So the symptoms worsen over time. Because again, a lot of the traditional treatments are treating the symptoms and they're not treating the causes. Okay, so traditional medical treatments, like I mentioned in an earlier slide, most people are told by their doctor that they're going to have to live with it. They have nothing to offer them other than medication. That's just how this Western world manages neuropathy symptoms. Gabapentin, Lyrica, antidepressants, pain medicine, pain pills. That's what is being prescribed to folks with neuropathy because it does hurt. It does cause, tingling and numbness. Again, it comes back to the symptoms. But the concern too is a lot of these medications have so many concerning side effects. You're drowsy, you might have brain fog. Some of them have, there's some studies showing now long-term use of gabapentin is leading to cognitive impairments. So you're having to deal with these side effects just for maybe a possibility of some relief. And that's scary. So again, medication limitations, we talked about that, dizziness, fatigue, and the nerve damage often remains, right? So again, it's just symptom management. And nothing against symptom management, sometimes that's great, right? Like we want to feel better, that's an important part of it, but it's also the cause. Let's get down to the root cause and let's figure out the circulation issue and let's figure out the nerve issue. So can they heal? Can nerves heal? They can. They can. They take a long time, but they can. So it's a really cool process. It's called neuroplasticity, okay? So neuroplasticity is when neurons fire together repeatedly, okay? The nervous system can create new synapses, new connections, and recruit alternate pathways, okay? So like going back to that slide that I had where, you know, you had that clear signal, but then another one had like a little X and then a little X. Well, the nervous system is really cool because it can actually kind of bypass those little X's, okay? And we call that axonal sprouting, or you can develop collateral nerves. But the stimulus has to be specific, repeated, meaningful, and challenging but achievable. Okay, we'll talk a little bit more about this, but yes, nerves can heal through neuroplasticity. I think of, has anybody ever tried to change a habit? Right? Okay. Right? Isn't it hard to change a habit? It's just like so deeply ingrained in what you do. But if you try at it, and you try at it, and you try at it, you can do it. But it's hard. The nerves are the same. Okay? Okay. So a comprehensive approach to nerve health here. So this is how we do this. So it's kind of like rebooting your computer. Anybody, computers, they drive me crazy. Something's always going wrong with them. But if you call technical support, what's the first thing they tell you to do? Turn it off and then turn it back on, and it works like 90% of the time. You're like, oh my god, okay. So rebooting, and then neuroplasticity here. So again, repeated, consistent, specific, meaningful, right? Building a new habit. And it's a holistic approach, okay? So there's a holistic approach here. So we need the proper treatments. We do need the lifestyle changes. We do need maybe some changes to diet or supplements if we're not getting enough B vitamin or something like that, right? Modern treatments for neuropathy are going to aim to stimulate nerves, to improve your circulation, and to restore the communication, the signaling. All right, this is the new treatment method. It's multifaceted. Okay, so one option for improved circulation, there are some electromagnetic therapies like PEMF and EMTT, and these early studies are showing that it can improve some microcirculation to tissue and nerve tissue, okay? So that's a positive thing. Also red light therapy, red light's coming back with a vengeance. It's really awesome how the cells are absorbing light, and that increases our ATP production and increases vasodilation, so it makes our vessels larger so it can improve circulation. All right, so a lot of different treatments are coming out, fairly new-ish to the healthcare scene for improved circulation, but this is just a few. And stem pod therapy. So in just a second, I'm going to pick a volunteer or victim, somebody, a volunteer, willing participant, so we can do this example with stem pod. So stem pod uses pulsed radio frequency stimulation. We apply it over specific nerves to activate the damaged nerves, to improve the communication, to improve the nerve signaling, okay? So the science behind all of this is that it influences a sodium and calcium membrane. This is in the nerves, okay, so like in these little neurons, and it helps to regulate how those nerves work again, okay? What treatment with stem pod feels like? Usually feels like a gentle tapping. It might feel like a little tingling. You might get your muscles kind of moving. It takes about 5 minutes on each nerve, and most studies are showing now that stem pod 2 times a week for 2 months can be effective for long-standing neuropathy, especially if you've had it for years. All right, so it's going back to that holistic approach. What do we need to do? We need to improve circulation, we need to improve nerve signaling, and we need to get that system communicating again. We need to restore those pathways.